What causes large, cannon, waves in the jugular venous pulse, and what do they look like? Large, cannon, waves in the jugular venous pulse signify atrial contractions against a closed tricuspid valve. They are most commonly seen in AV dissociation, ectopic atrial beats, and junctional or ventricular rhythms. Visually, cannon A waves appear as unusually prominent pulsations in the jugular vein, often noticeably higher than regular venous pulsations. Case scenario: the patient with irregular rhythms and distended neck veins. A 70-year-old patient with a history of atrial fibrillation presents with palpitations and visibly distended neck veins. On further examination, large, cannon, waves are noted in the jugular venous pulse, appearing as significantly elevated and rhythmic distensions of the vein. An EKG shows episodes of AV dissociation. Clinical pearls. 1. Cannon A waves are visually prominent, rhythmic, and appear more elevated than regular A waves in the jugular venous pulse. 2. Large A waves indicate a hemodynamic aberration that necessitates further evaluation, usually echocardiography or invasive hemodynamic monitoring. 3. AV dissociation, where the atria and ventricles beat independently, most frequently results in this phenomenon. 4. Ectopic atrial beats can transiently cause large A waves but are usually less clinically significant. 5. Junctional or ventricular rhythms can also lead to this sign. Immediate rhythm control may be required. Diagnostic measures. EKG is essential for rhythm assessment and potential underlying cardiac pathology. Invasive hemodynamic monitoring may be required for precise characterization. Management. The treatment strategy depends on the underlying etiology. Antiarrhythmics or cardioversion for rhythm abnormalities, for instance. Statistics. Incidence of AV dissociation in the general population is relatively low, occurring in less than 1% of people undergoing EKG. Source: American Heart Journal. Further reading. For a comprehensive understanding, consult Cardiology, an Integrated Approach, or the American Heart Journal.